Time now to go in depth on this Friday. We're going to take a look at Priority Health and a practice called Stereotactic Radiosurgery. That's a form of cancer treatment that consists of a single large radiation treatment. Now, because the doses are so large, the radiation beams are aimed with high precision. That allows radiologists to deliver a much higher dose of radiation than traditional therapy, thereby sparing healthy tissue. Health Team 9's Dr. Randy Shuck takes a deeper look with both a doctor and a patient.
Joining me now is Dr. Thomas Dilling. He's a radiation oncologist out of Moffitt Cancer Center. Thank you for joining us today.
Sure, absolutely, my pleasure.
Today we're going to talk about stereotactic radiosurgery, or SRS. Could you explain that in simple terms of what we're talking about?
So the concept is using very high dose radiation delivered to a very precise location. Typically when people get radiation, you may know a patient, for instance, who's had prostate cancer. They may have 7 or 8 weeks of daily treatment 5 days a week. And the concept of this is to deliver a very high dose that's even higher than that over just one fraction or a handful of fractions, typically under 5 fractions.
Wow, so we're talking about a high dose of radiation going into one specific place.
Correct.
Is it safe?
It is safe, actually, and it turns out that it's very well tolerated as well. The secret is to use some modern technologies in order to be very accurate in the dose delivery and make sure you're delivering it in the correct location.
So we're talking about a lot of physics here, but what kind of radiation are we talking about? Are we talking about sun radiation? Are we talking about X-rays? What do you want to...
So this is actually photons, so X-rays, yes, at a certain dose, and it's just a certain quantity of radiation such that the dose is ultimately high.
Now, is this different than other types of treatment for radiation?
Well, basically, the main concept for the standard prostate treatment would be, again, photons as well, just to a lower dose per day. There are other modalities, such as gamma knife, that are sometimes employed for stereotactic radiosurgery in the brain. There's some technical differences. It uses actual radioactive sources, and it's sort of essentially a large helmet that is placed around the patient, and they turn on certain beams to focus it.
So we're talking about focusing the beams into one little area, making sure it all happens. Does there any pain along with it, or is there any risk?
Actually, no. It's very well tolerated acutely. The patients have a certain immobilization system to hold them very still so that we can maintain that millimeter accuracy. And it's not really uncomfortable, it just keeps them very still. But the treatment itself doesn't hurt at all.
Cool. Now, you're using this for lung cancer right now. That's your specialty.
Correct.
Is it used in any other things?
Absolutely. So it started in the brain, actually, probably in the early 70s, and has moved to other areas of the body once we developed these new technologies for mobilization and so forth, and imaging. So lung is probably the most common area outside of the brain, but it's now being employed as well in the spinal cord, the liver, the pancreas, kidneys, adrenal glands, and some other areas as well.
Wow, that's a lot. Now, do you do all that, or is this a specialized thing?
Well, I don't. At Moffitt, one of the benefits is that you have specialized radiation oncologists that work on that particular disease site. So they have specialized expertise in employing this technique for that disease.
Well, that's a lot of information in a short period of time, but thank you so much for joining us today.
Sure, it's been my pleasure. Been my pleasure.
Joining me now is Allan and Trish Gogo, and you are patients that has had some sort of surgery in the past. Now, we talked about stereotactic surgery. They call it all sorts of different names. Your doc was on right before us talking about the procedures, and we'd like to hear from your side of it as a patient. So, Allan, tell me about what it felt like to go through the procedure itself.
Well, to be really candid, when I heard about the program, I was apprehensive. I had some apprehension about it, but you know, my situation was that I really didn't have any option. I was told that after 5, 6, 7 years, that the oncologist I had at that time said there really wasn't anything else he could do for me, and then became aware of this program. And was afforded an opportunity to interview with Dr. Dilling, who runs the program, and went through somewhat of a dry run, so to speak, to see that would I qualify.
Now let's go backwards for just a second so we can tell everybody about your,
Yes.
your medical history, if that's okay with you.
Yes, fine.
So you had had lung cancer before, and they had taken out your lung
The
on
right
one
lung,
side,
right.
and then you had cancer that showed up on the other side, so that's why you had limited options.
Yes.
And then you had a solitary or single tumors, and so they said that you would be a candidate for this type of surgery, which is radiation going to that spot.
Yes.
And so you had to learn about it. And then, so what was your initial take? You said you're a little bit hesitant. I understand that part. Were you overtly afraid, or what was the downside?
No, I think when you go into a program that you really don't thoroughly understand in that it's natural to have some apprehension.
Of course.
But nonetheless, I'm awfully happy that I went into the program.
Absolutely. So
And the program for me has really benefited me.
Well, it saved his life, we believe.
Really
Yeah.
saved my life,
So
I think.
when you went in to get the stuff done, what did they do with you first? They went in, they kind of marked the area up, and then you're able to go through the process. How long did that take?
The simulation, you
The
mean?
simulation, about 35, 40 minutes.
Okay. And then each treatment lasted how long?
About 10 minutes. The actual radiation was
Once they
about
got you all set
10
up.
minutes.
Well, but the preparation each of the 5 days was 35 to 40 minutes because you still have to go through the same prep.
Right.
It's the radiation that took 10 minutes.
Right. So when they say prep, you're saying like they had to put them
The
in the right
body
position
cast,
and
you had to
everything.
put them
The
in the
body
body cast, the plastic, the this, you know, so.
So then they could put that radiation right at the right spot. That's why they call it stereosurgery.
Exactly.
Yeah.
Exactly.
Yes.
So do you have any sensation? What did it feel like when you went through this?
Believe it or not, I didn't feel any different.
So you didn't really
I
know if
didn't
they
feel
did
any
anything,
different
huh?
when I went through it.
Yeah.
And I didn't feel any different after it.
And how quickly did they tell you had results? Did they take a picture of you afterwards and say it's all gone, or how did that work out?
Well,
It was
I
a month.
underwent on a 3-month period. I had a CAT scan
Yep.
every 3 months, and met with the oncologist, and he took a reading on exactly what the condition was after versus prior to. And I went through CAT scans every 90 days for
8 years.
8 years.
So you've had this procedure a long time ago, and here you are today, because typically what we have with cancer is that you have a window, like 2 years, so you're way outside that window for survivability. So
Yes.
very good. Would you have any parting words for someone who may want to go through this?
Well, let my wife
Do it.
Do it.
Well,
Yeah.
I think that when you find out like we did, when the doctor says, when one oncologist says there really isn't anything else we can do for you, and then we get a phone call later saying that there is a possibility that you would qualify for this program. And even if a program sounds scary, if you don't have any other options, it has kept Allan alive at least 5 additional years, in our opinion.
Yeah, sounds great. Well, thank you so much for joining us and sharing your medical history and helping out our viewing audience.
Our
Well,
pleasure.
Thank you much.